A local doctor promises to take the crazy out of corona, selling so-called corona bundles of supplements at her offices, claiming to boost immunity and combat the virus. She's also been offering drive-through testing, offering people peace of mind. But tonight we hear from one patient tested at this doctor's clinic that left with more questions about the test and a controversial prescription in hand.
Hi, good afternoon. I'm Dr. Kelly Birkenstock.
A doctor who operates an anti-aging office.
We're here to give you another Take the Crazy Out of Corona update.
Has turned her skin repair clinic.
If you're positive, we will give you medications immediately.
Into a COVID-19 drive-through testing site, testing dozens of patients a day.
26th on Friday.
With potentially dangerous ramifications.
Well, it's certainly worrisome.
Suzanne Linden paid $159 for a drive-up COVID-19 antibody test.
I was feeling tired, I was having headaches, and I was just paranoid about having the virus.
Dr. Kelly Birkenstock, who operates skin clinics in Mandeville and New Orleans, told her she tested positive for COVID-19.
And they told me I was positive. I was in shock.
So shocked, Linden wanted a second opinion.
Got a doctor's order to be retested at Ochsner, and those test results came back that we were in fact negative, not positive.
Before Linden's test, she says she told Birkenstock she had minor symptoms.
So you didn't have a fever?
No.
You didn't have a cough?
No.
Did she say you had coronavirus?
Yes, and she gave me a slip saying that she circled positive for coronavirus.
But even with minor symptoms, Birkenstock prescribed a trio of medications, drugs she claims to prescribe for every patient who tests positive, in several online videos.
If your COVID test is positive, depending on your symptoms, we give you one of two sets of prescriptions. All of them contain the hydroxychloroquine and the azithromycin, as well as zinc.
So after telling Linden she tested positive, Birkenstock prescribed her the powerful antiviral drug hydroxychloroquine, a drug in short supply.
I don't know how to say it delicately, but that's pretty poor medicine.
Another patient has a similar story. Someone in their 20s tested positive, but that day received a negative test at another clinic. That patient didn't want to do an on-camera interview with us, but says Birkenstock also prescribed hydroxychloroquine. The FDA tells doctors to carefully review warnings and drug interactions of hydroxychloroquine before writing a prescription. Linden and the other patients say Birkenstock never did. Former New Orleans Health Director Brobson Lutz reviewed the test result Linden received from Birkenstock. He says it tests for two antibodies, IgG and IgM. According to Lutz, the IgG band shows the patient had COVID-19 at one point, but not currently. The IgM band would suggest the patient has it now. Lutz says the middle band, IgG, has a red line. The lower IgM does not.
So the test you reviewed shows she allegedly had it at some point but didn't currently have coronavirus.
That's correct. There was not an IgM band present on that test. There was a suggestion of an IgG band. I reviewed it myself. I also asked an immunologist to review it, and we concurred on that opinion.
According to the test results, the patient didn't currently have COVID-19 at that point. So why would the doctor be prescribing her pretty serious antiviral medication?
First year or second year medical student knows that it takes the presence of IgM in an acute infection. And while a person was given a prescription for multiple medications who had the findings, Lee, that showed up on that little point of test kit is beyond me. It is not good medicine.
At the time of Linden's test, the FDA had only approved one antibody test for clinics. It's unclear where Birkenstock received her tests. Many unapproved tests have flooded the market, and the federal government is skeptical about these serology tests.
And yesterday on our call with the Vice President, Dr. Birx, she talked about how serology testing has a pretty high rate of inaccurate results.
We sent a photographer to her office to get tested. He returned a negative result, but Birkenstock still had a recommendation.
The other thing is the MMR, which is just a little measles booster. That has absolutely 6 research articles, again, on my Facebook and on my website. Research scientists that are showing how it blocks the COVID pathway.
We went to her website and didn't find 6 research articles on the MMR vaccine. She only had 1, but it wasn't research, just an editorial by an LSU professor that has yet to be approved as a legitimate study. The professor's concept or theory, a vaccine booster might be protective against the sepsis that can occur with COVID-19.
Does the MMR vaccine help prevent coronavirus or protect you from coronavirus?
Absolutely not. I can't even think of any biological basis for that.
Birkenstock also had our photographer perform a breathing test.
Hold your breath. Mississippi 1, Mississippi 2, Mississippi 3, Mississippi 4, Mississippi 5, Mississippi 6, Mississippi 7, Mississippi 8, Mississippi 9, Mississippi 10. Were you able to hold it the whole time? Okay, it's a silly little test. It's the best we got right now.
Dozens of articles say the holding your breath test doesn't diagnose coronavirus. The chief of infectious disease at the University of Maryland even posted on Twitter, wrong, calling it a myth. Birkenstock offered our photographer a reduced rate on a follow-up test.
We discount retests to $89.
Okay, I wanted to ask how much it was.
Yeah, we're not paying ourselves. We're just trying to cover some of our costs.
Birkenstock completed an internal medicine residency from LSU in 1999. Birkenstock says she continues to practice that type of medicine. We don't know how big that part of her practice is. Her website shows only services related to skin and anti-aging. On Facebook, many clients compliment the fabulous information she posts. One former hospital nurse wrote, "I think it's really good that you have found several different angles on treating COVID-19. But one Ochsner doctor criticized Birkenstock, writing, "You are creating a dangerous false sense of security and using resources irresponsibly. Please familiarize yourself with the CDC guidelines." We called Birkenstock on the phone to schedule an interview. She told us by text she would do a Zoom interview last Thursday at 3 o'clock. 1 minute before 3, she sent us an email. The interview was off. Before canceling our interview, she texted us, "I can't wait for a discussion tomorrow. I have nothing to give but honesty and wholeheartedness."
Every female that we think of as beautiful, although they may not look the same, they have the same mathematical equation. Does that make sense?
A doctor who for years gave clients beauty tips.
One of the wonderful things about Botox, if you wanted to try Botox and hadn't tried it before.
Since July, she's been on our newscast 8 times, giving advice on Botox, hair restoration, and anti-aging. But now she's changed her focus, touting her COVID-19 treatment.
So you didn't even test positive for having a potential active infection?
Correct.
Yet she prescribed this medication to you.
Yes. My biggest concern is that I was prescribed medications that we don't know if they were safe for me to take or not.
There is some research underway that is looking to see if the MMR vaccine helps with COVID-19, and Birkenstock has been communicating with some of the doctors involved in one of those research projects. Birkenstock told us the 10-second test is a diagnostic tool she uses, much like taking temperature, pulse, or blood pressure. She says she never implied it was a COVID-19 test. Again, Birkenstock refused an on-camera interview, but in a statement told us, "I am pleased that I have been designated as a physician investigator by the Federal Centers for Disease Control and Prevention to actively participate in the conducting of clinical trials regarding the use of certain investigational drugs, effectiveness on COVID-19 patients with mild symptoms on an outpatient basis. I am volunteering my time on this clinical trial without compensation, as many other dedicated doctors have, in an effort to defeat this deadly virus." Birkenstock also told us new information has come out, and she has since stopped prescribing the controversial drug hydroxychloroquine for COVID-19.